Cancer is the second most common cause of death after heart disease. A significant percentage of newly diagnosed cancers can be cured. Cancer is more curable when detected early. Although some cancers develop completely without symptoms, the disease can be particularly devastating if you ignore symptoms because you don't think what these symptoms might represent. Today, we will tell you about 10 warning signs of cancer you should never ignore. Number 10. Pain. Bone cancer often hurts from the beginning. Some brain tumors cause headaches that last for days and don't get better with treatment. Pain can also be a late sign of cancer, so see a doctor if you don't know why it's happening or it doesn't go away. Don't ignore pain. If you have new and ongoing discomfort, get it checked out. But bear in mind that many cancers don't hurt. So, if you have a lump that hasn't gone away, get it checked out, even if it doesn't hurt. Most breast cancers are not painful, and a growing mass that's not painful is concerning. Number 9. Weight loss without trying. Almost half of people who have cancer lose weight. It's often one of the signs that they notice first. Most adults do not lose weight without effort. So, if you are losing weight without going on a diet or exercise program, talk to your doctor. Weight loss of 10 or more pounds that cannot be explained could be a sign of cancer. Stomach, liver, and pancreas cancers can all cause loss of appetite. Colon cancer can prevent the colon from properly absorbing food and nutrients, causing weight loss. Other cancers can cause mild nausea, which may mean you eat less. But weight loss is not always a sign of cancer. It could be that you have lost your appetite or are skipping meals for other reasons like stress or depression. Number 8. Fatigue. If you're tired all the time and rest doesn't help, tell your doctor. Leukemia often wears you out, or you could have blood loss from colon or stomach cancer. Cancer-related weight loss can leave you exhausted too. This is more than feeling tired after a busy day. Ask yourself, does my tiredness limit my activities? If you can't get out of bed to go to work or do something fun with friends, even if you seem to have had enough rest, that's a concern. There are a lot of other diseases that can cause tiredness though, so fatigue is not the number one symptom of cancer. Talk to your doctor. Number 7. Fever. If it's high or lasts more than 3 days, call your doctor. Some blood cancers like lymphoma cause a fever for days or even weeks. People who have cancer will often have a fever as a symptom. It's usually a sign that the cancer has spread or that it's in an advanced stage. Fever is rarely an early symptom of cancer, but it may be if a person has a blood cancer, such as leukemia or lymphoma. In the medical community, FUO stands for Fever of Unknown Origin. This term is used to describe a fever that meets all of the following criteria: temperature of 101 degrees Fahrenheit or more, lasts for at least 3 weeks, has no other identifiable cause after 3 days of investigation in the hospital or after 3 or more outpatient visits. FUO is not just any old fever that lacks an obvious cause. In FUO, the fever has to be prolonged, and there has to be a pretty extensive medical workup to rule out other numerous likely causes. The length of time in this definition, however, conveniently tends to get rid of some of the numerous more common causes of fever that resolve within 3 weeks. Having a fever of unknown origin does not necessarily mean you have cancer. In fact, there are a huge number of possible causes that are non-cancerous. Number 6. Changes in your skin. Have your doctor look at unusual or new moles, bumps, or marks on your body to be sure skin cancer isn't lurking. Your skin can also provide clues to other kinds of cancers. If it's darkened, looks yellow or red, itches or sprouts more hair, or if you have an unexplained rash, it could be a sign of liver, ovarian, or kidney cancer, or lymphoma. Sores that don't heal, spots that bleed and won't go away are also signs of skin cancer. Oral cancer can start as sores in your mouth. If you smoke, chew tobacco, or drink a lot of alcohol, you're at higher risk. Cough or hoarseness that doesn't go away. A cough is one sign of lung cancer, and hoarseness may mean cancer of the voice box, the larynx, or thyroid gland. If you see or feel a new lump or mass that's been there for a few weeks or is growing, get it checked out. Many lumps are not cancer, and your doctor may be able to tell you right away. Number 5. Unusual bleeding. Cancer can make blood show up where it shouldn't be. Blood in your poop is a symptom of colon or rectal cancer, and tumors along your urinary tract can cause blood in your urine. Urinary tract infections are the more common cause of urinary complaints in women, but recurrent or persistent complaints may signal an underlying malignancy of pelvic organs pressing upon the urinary bladder. Seeing fluids where you don't normally see them can be a sign of cancer. If you're a woman, this could be vaginal bleeding or discharge different from what is normal for you. It could also be bloody discharge from the nipple. Number 4. Change in bowel or bladder habits. This can mean blood in the urine or stool, or changes in the stool. For example, your stool may be pencil thin or black. Any of these could be a sign of colon cancer. For men, urinating more often can be a sign of prostate cancer, because it may mean you are not emptying your bladder fully. Having more difficulty urinating can also be a sign of prostate cancer, although more commonly it's because of another less serious condition. For women, unless you're pregnant or drinking more water, urinating more often can be a sign of gynecological cancers. Take note if you also feel full, have abdominal pain, and experience bloating. Number 3. Anemia. This is when your body doesn't have enough red blood cells, which are made in your bone marrow. Cancers like leukemia, lymphoma, and multiple myeloma can damage your marrow. Tumors that spread there from other places might crowd out regular red blood cells. Number 2. Indigestion or trouble swallowing. There are some benign throat conditions that can cause problems with swallowing, but indigestion or trouble swallowing also can be a sign of esophageal cancer. If you're having trouble swallowing, perhaps with pills or meat, talk to your doctor. If you've been having indigestion as well, that makes it more of a concern. Number 1. Nagging cough or hoarseness. A persistent cough or hoarseness can be a sign of lung cancer. Hoarseness can also be a sign of tumors on or near the vocal cords. Lung cancer kills more people than any other cancer, so it's important to watch out for these symptoms, especially if you are a smoker. Cough can occur for any number of reasons. It's your body's natural way of getting rid of unwanted substances. Colds, allergies, the flu, or even low humidity can lead to a cough. When it comes to lung cancer, however, the cough can persist for a long time despite remedies. The cough may be frequent, and it can cause hoarseness. As the disease progresses, you may even cough up blood. A persistent cough is also sometimes a symptom of thyroid cancer. Do share in the comments if you know about more warning signs for cancer. Please subscribe to the Health Awareness. Thanks for watching.